Okay, Mr. Smiley, sorry about the wait there. Welcome to Nova Dental today. We're going to be bleaching that tooth for you, right? That's all you want?
Yep.
Okay, we'll get consents later. Don't worry about that. Let me see. I can show you. We drew a diagram of how this is going to go.
Okay, that would be great.
Alright, Mr. Smiley, this is what we're going to do. You can see here, this is all the gutta percha that you had from the root canal that we already did for you. What we're going to do is we're going to come into the tooth from the back here, and we're going to just take away a little bit more of the gutta percha right here and seal it with some glass ionomer so that everything down here is nice and sealed, far away from the bleaching material. Then we're going to coat the walls just like this with the sodium perborate on the front, the back, all the sides. Then we're going to clean it all out, put in some cotton pellets, and seal it up at the top with some Cavit cement. That's what we're going to do today.
Well, that looks all good, but I read on the internet that there's a chance I can have a root resorption.
Oh, well, you know, there is a percentage of people that does happen to. It is a risk. I should have explained that to you earlier. It could happen when using agents such as superoxole, which is caustic and could degrade through the tubules and cause internal and external root resorption.
Observe as the dentist is preparing the patient for his internal bleaching procedure. You could also observe the dental instruments that will be used, as well as acid etch, primer, bonding, and composite. Rubber dam is placed, as well as isolation clamp, in preparing the tooth for the internal bleaching. Acid etch is injected into the access of the tooth, which opens up the dentin tubules and allowing for a better apical seal. The acid etch is being removed with suction and water, and now the access is being prepared with a bonding and primer agent. This will allow the resin to bond properly to the tooth. It is important to make sure that none of the bonding agent will be cured onto the walls of the internal walls of the dentin tubules, so that it will close the tubules and therefore prevent any internal bleaching to have an effect. Composite is placed with precision 2 millimeters below the CEJ up to the CEJ, and then licured. The root filling does not adequately prevent diffusion of bleaching agents from the pulpal chamber to the apical foramen. A base is required to prevent radicular penetration of bleaching agents. Therefore, sealing the root filling with a base is essential for a variety of dental materials, such as glass ionomer, intermediate restorative material, Cavit, resin composites, photoactivated temporary resin materials, zinc oxide eugenol cement, and zinc phosphate cement have been suggested as an interim sealing agent during bleaching techniques. Once the base is cured, we will use a probe to measure the levels of the CEJ internally and externally to verify that a 2 millimeter seal has been put in the proper place. The bleaching material that we will be using will be a mixture of water and sodium perborate. The mixture is placed into the access and above the base. The sodium perborate and water mixture are now made sure that there is no excess around the canal surface and orifice as we are cleaning up the front area. A cotton pellet is now placed above the mixture, about 2 millimeters into the canal, to give enough room for the temporary material to be placed and seal up the orifice. Observe packing of the cotton pellet. Cavet will be used as a temporary filling material to seal up the excess. Instruments are used to remove excess cavet and contour properly for proper occlusion. Once cavet has initiated its setting, we will then remove the rubber dam and inform the patient that internal bleaching does take time, and that we will be periodically evaluating the tooth of interest to determine whether the tooth will need more internal bleaching